Hello, thank you for having us here at Oaks Dental Clinic. So could you please first quickly introduce yourself a little bit to us?
Yeah, I'm Dr. Bae, founder of Oaks Dental Clinic, and also I am practicing dentistry for 30 years.
Perfect. So today we will have a few questions about dental crowns. And the first question is, what is a dental crown and when is it necessary?
Dental crown is a kind of cap that covers the tooth shape. When the tooth is fractured or chipped or weakened by some forces, maybe or decay, we can make a cap, mimic the natural tooth. Also, we can make crowns for the implant, or sometimes we make bridges to recover the function in the missing areas.
Perfect, thank you. So how long do dental crowns typically last?
As long as the proper material is chosen, there's no problem to last forever, for lifetime. In our clinic, we use zirconia. Zirconia is a kind of most durable materials and very strong materials. There is no problem to make it. There is no problem to last forever.
Perfect. So you mentioned right now that there's different types of crowns. So how do I know that I choose the right one for myself? How is that decided?
Depending on the size of the cavity and depending on the position of the tooth, we choose the materials. Sometimes flown areas, for example, flown areas, but most aesthetic is necessary needed areas, we use kind of porcelain. Porcelain is the aesthetic materials, but it's a relatively weak material. So in molar areas, where the strong forces anticipated, we use zirconia to recover the function and the trim efficiency.
Next question is, does getting a dental crown hurt? What are the pain levels?
At the most of cases, before start making crowns, we do anesthesia. So as long as the proper anesthesia is done properly, there's no problem. And also, after preparation, we make temporary to prevent further stimulus, such as cold and hot problems. But there's no problem.
That's good to know. So do I need to follow any special aftercare instructions for dental crowns?
Yeah, actually, our staff and the translator will give you aftercare instructions. But if there is any questions, concerns, you can contact them anytime, 24 hours, 7 days.
Perfect, thank you. So, can I eat and drink normally with dental crowns?
Yeah, there's no problem. But wait, for the time being, the restoration is being made. You can have some temporaries, and temporarily you can protect your tooth perfectly. There's no problem at all.
Perfect. And are there any risks or complications associated with dental crowns? If the patient take care of the tooth normally and the hygienic measures is taken properly, there's no problem at all. That's perfect. So, one more question. Are there alternatives to crowns for tooth restoration? Are there any other ways than crowns?
Actually, the crown is made for the heavily fractured tooth or heavily chipped or worn out tooth. But sometimes if the cavity size is small and the fracture fragment is small, crown can be replaced with onlay or small fillings. Or sometimes you can use porcelain materials instead of zirconia.
Perfect. And the very last question, how do you make your crowns here at Oaks Dental Clinic?
Actually, we are frontiers in this kind of work CAD/CAM, one-day treatment. In this kind of one-day CAD/CAM system, we are frontiers in Korea. So most of the restoration is made by ourselves in our clinics, by our technicians. So sometimes veneers and partial crown can be done just one day, but the zirconia is 2 times the appointment is necessary. But all of the restoration is made by ourselves in our lab. So I'm proud of our skills in this field and that kind of process.
Perfect. Thank you so much for today.
Okay, thank you.